these procedures?
Actually, we do, Patrick. We probably see, on average, one every 2 to 3 weeks from someone who's been to Malaysia, Thailand, or somewhere, usually in Southeast Asia, who've had problems following plastic surgery or cosmetic surgery. And so it's not an infrequent occurrence, and it's obviously a big ordeal for them to come back here within 3 weeks of having surgery and then have repeat surgery for problems that might arise.
So what kind of procedures are they having? I mean, you're essentially fixing up a lot of these botched jobs that come back from their overseas trip to Australia. What sort of procedures are you talking about?
So mainly it's in the realm of breast augmentation surgery, so surgeries where surgeons are increasing the size of and changing the shape of breasts, and often we might see a problem related to the incision placement, which is sometimes in the armpit, and we can often see infections or implant that have been put in the wrong spot, and so we see quite a range of problems. Obviously, people with DVTs, with deep venous thrombosis, following those surgeries, we sometimes might see them as well in the setting of another problem. But the list. So then that's just in breast augmentation, but then also people having breast reductions and breast uplift surgery, as well as abdominoplasty surgeries with wound healing issues and infections. The list really does go on and on of people having problems
Nicholas,
in overseas settings.
In your professional opinion, you've been doing this for a very long time. Why are some of these procedures going wrong overseas?
Well, I just think that without actually knowing the fuller details of the surgeries being performed, but I know that in Australia, to call yourself a plastic surgeon, you have to be a member of the Royal Australian College of Surgeons, and that usually takes 17 years by the time that you enter medical school to finish becoming a plastic surgeon. So I just wonder whether the training is absolute and as rigorous as what is done here. And I think what's happening is there are people calling themselves plastic surgeons and cosmetic surgeons, and they're in fact not. And they're operating outside their lane, so to speak. And I think that's the issue. They don't have the experience and the surgical know-how to deal with these patients.
And Nicholas, there have been some reports of an increase in botched cosmetic surgery procedures administered here in Australia also by underqualified doctors. Have you seen evidence of this?
Yes, definitely. I think the population generally is maybe wising up to the fact that medical tourism is not what it's cracked up to be. So, that people are not having a holiday and coming back looking perfect. So I think there has been a mushrooming of cosmetic surgeons here in Australia who basically may just have a medical degree only. They might just be GPs, and then are hanging up their shingle as cosmetic surgeons, again without any surgical training. And that's really
so
the same.
So just to clarify, what you're talking about there is those with a medical degree but no further training doing specific procedures in cosmetic surgery.
Yes. So there's no regulation at the moment within Australia for anyone to call themselves a a cosmetic surgeon.
I mean, that just sounds remarkable.
Exactly.
How is this possible that could happen in Australia? I mean, surely there are regulations for this kind of surgery.
This is it, Patrick. This is the whole thing, is that you'd think that if you can call yourself a surgeon, you actually have to have surgical training. But to call yourself a cosmetic surgeon, at least in New South Wales, all you need is a basic medical degree, really, which really doesn't, I think, afford patients that level of security that they're getting someone who's done lots and lots of surgery, especially in cosmetic surgery. And so that's the problem that we're facing, I think, as specialist plastic surgeons who have to take us 17 years to get to where we are. We're seeing patients who are having the similar problems like we're seeing with overseas patients because the people who are doing the procedures are not adequately trained.
Definitely a story we'll follow. Nicholas, I'd love to chat to you lots more about this.
Yep.
It's a fascinating topic. Thanks so much. We have run out of time there. Thanks so much for your time today. Much appreciated.
Thanks so much, Patrick.
That's Dr. Nicholas Moncrieff, a Newcastle-based cosmetic plastic surgeon.